Good morning from UN City here in Copenhagen, Denmark. My name is Banu Patnagar. Thank you for joining this WHO Europe press briefing today, our first in 2025. Today, we are very proud to launch our flagship European Health Report. Published every 3 years, it draws upon the most recently available data across all 53 member states of the WHO European region. It contains a wealth of data on numerous health indicators, including country-level data for the first time. We hope journalists will use this report as a vital source of information in your reporting over the coming years. Now, before handing over to the Regional Director, Dr. Hans Kluge, who will walk you through the findings of the report, let me also introduce Dr. Natasha Azopardi-Muscat, our Director of Country Health Policies and Systems, who is also on hand to take your questions. So, without further delay, Regional Director Dr. Kluge, over to you.
Good morning, everyone. We are living in an era of remarkable progress in health, with improved living conditions, medical advancements and public health initiatives. But while we are living longer, we are not necessarily living healthier. Before diving into the European Health Report, I'd like to acknowledge that, as all of you know, WHO is going through a challenging period right now. Yet, our core mission remains disseminating science and evidence to inform action. And this report is proof of that. So let's get to it. In 2024, for the first time, there were more people over 65 than under 15 years old in the European region. And projections show that there will be 3 times more people aged 80 plus by 2050. However, there is a 10-year gap between life expectancy and healthy life expectancy. This means millions of people in our region spend their last decade of life in poor health. They struggle with chronic diseases, disability, and lack of access to adequate care. On top of that, currently over 14 million people in our region are living with dementia, a number set to double by 2030. So if we do not act now, the gap between living longer and living well will continue to widen. So we must change our approach to ensure our populations not only live longer, but age in good health. And good health should really begin during childhood. Childhood sets the foundation for lifelong health and well-being. Yet key indicators are stagnating or even worsening across the region. Consider this. Every year in the region, nearly 76,000 children die before they turn 5. In several countries, childhood mortality is stagnating or even increasing. And there is a 21-fold difference in under 5 mortality rates across the region, which is unacceptable. Our young people are also facing new and evolving threats. Up to 23% of adolescents in the European region now use e-cigarettes, an alarming trend that risks undermining decades of progress on tobacco control. E-cigarette use among young people now even surpasses cigarette smoking in many countries. Also, 1 in 3 children is overweight, and 1 in 8 is living with obesity. What concerns us the most is that childhood obesity is not just about children. It sets the stage for a lifetime of increased risk of cardiovascular disease, diabetes, and other chronic conditions. Social media, online harassment, and digital dependency are increasingly affecting young people's well-being. And without action, the next generation will not only face a high risk of chronic disease, but a growing mental health crisis. Girls consistently report lower mental well-being compared with boys, with 15-year-old girls scoring 50 and boys scoring 62 on a 100-point scale. life satisfaction and self-rated health have also declined since 2018, especially among adolescent girls. Beyond mental health, girls also face a high risk of harm and mistreatment. In fact, more than 1 in 4 women and girls in the region experience violence in their lifetime. At the same time, men die by suicide at a rate 4 times higher than women. And this is sobering. Suicide remains the leading cause of death among young people aged 15 to 29. Turning to infectious diseases now. Vaccine preventable diseases are resurging. In 2023 alone, we saw 58,000 measles cases across 41 countries in the region and 87,000 cases of pertussis or whooping cough, the highest number in a decade. These diseases should be behind us, yet they're making a comeback due to declining vaccination rates, often fueled by misinformation and gaps in our healthcare. Only 7 member states in the region have achieved greater than 95% coverage for the diphtheria, tetanus and pertussis vaccine, measles vaccine and pneumococcal vaccine. And while some member states showed near complete coverage of these vaccines, others showed disparities. A low coverage rate of 62%, for example, was experienced in some member states for the measles vaccine. These figures highlight substantial inequities in immunization coverage, with some countries making remarkable progress while others continue to lag behind. Meanwhile, antimicrobial resistance, or AMR, remains a critical threat to global health. We are also falling short in tackling infectious diseases such as tuberculosis, HIV and hepatitis C. Despite a 25% reduction in tuberculosis incidence and a 32% decrease in tuberculosis deaths between 2015 and 2022, drug-resistant tuberculosis remains a challenge. Drug-resistant TB accounts for 1 in 4 new cases and over half of previously treated cases. But there is reason for optimism. New evidence shows that a drastically shortened 9-month treatment plan only with oral drugs for multi-drug resistant TB achieves a treatment success rate of 83%, significantly surpassing the current average of 57%. Previously, treatment for drug-resistant TB could last up to 3 years with painful injectables. Turning now to non-communicable diseases. Despite progress, 1 in 6 people in the region die before the age of 70 due to the 4 major NCDs: cardiovascular disease, cancer, diabetes, or chronic respiratory diseases. Cardiovascular diseases remain the top killer, especially in Eastern Europe and Central Asia. Cancer is close behind and is exerting significant pressure on our health systems, particularly in Western Europe, where people are living longer. But it's not just genetics and aging, it's also and very much lifestyle. Our region is home to the heaviest drinkers in the world, with adults averaging nearly 9 liters of pure alcohol per year. Tobacco use also remains high at over 25%. Almost a quarter of adults are living with obesity, a 20% increase since 2006. In some countries, obesity may soon overtake smoking as the leading cause of preventable cancers. That's why the health systems must transform to meet changing health needs. Despite record numbers of health and care workers, they are not effectively distributed. As demands for service increase, workforce supply cannot keep up. A further challenge is the aging health workforce. Across the region, 30% of doctors are over 55 years old and quickly approaching retirement. Out-of-pocket payments for medicines, particularly for low-income groups, burden families and push us further from universal health coverage. Up to 1 in 5 households in some parts of our region have to forego basic needs like housing, heating, or education to pay for healthcare. And finally, very worrying, our health systems are no better prepared for emergencies today than they were before the COVID-19 pandemic. The European region stands at a crossroads when it comes to the future of health. As health systems face increasing strain, more of the world remains unsafe. Avian influenza, mpox, and Marburg virus do not respect borders. The European region must be bold and innovative in its efforts to build healthier, more stable societies, but we must also realize that health security is key to national and international security. Keeping health high on the agenda means working together to build a safer, more resilient world. Thank you.
Thank you very much, Regional Director, for that detailed presentation. Truly a wealth of data here to be mined in the report. Now let's move to the sort of Q&A section of our press briefing. As I said, if anyone has a question, please type it in the chat or raise your hand while we wait for some of you to muster up the courage to do that. Natasha, I'd like to come to you, Dr. Muscat. Your team and you were responsible for this amazing report. I wanted to maybe touch on, pick the adolescent mental health issue out of the report that Hans mentioned. We know there is a mental health crisis in the European region. But the question is, how do we actually address it? How do health systems and how do governments go about addressing this crisis, and especially among our young populations?
Thank you, Banu, for that question. And of course, although the health system does have a role to play, and for example, we published just a couple of months ago for the first time a set of quality standards for mental health of children and adolescents, this is something that requires the support and action from sectors outside the health system too. It requires us to work with education, with the justice system, with social policy, with ministries responsible for regulating technology. As we ask ourselves what is different today to previous generations, one of the things we notice, for example, also from our Health Behavior School Children survey, is that a number of adolescents are experiencing the effects of addiction-like symptoms when it comes to digital social media, particularly girls. And over here, we know that there are actions that need to be taken in terms of improving their literacy, in terms of supporting parents, in terms of understanding also what these impacts are likely to be. And we are working, in fact, on an evidence brief, which will be published shortly, in order to really take a look at what is driving this and what actions member states can consider taking.
Great. Thank you so much, Dr. Muscat, for that. I see we have a hand up from Lauren, Lauren Shadwick at Euronews. Hi, Lauren. Nice to see you or hear you. Please go ahead.
Hi. Thank you so much for taking the time to do this. There's a lot of different messages in this report and a lot of really interesting data. And I was wondering, what is your kind of main takeaway from the report? Was there anything surprising on a particular health issue? So that's my first question. And then just a second question, if I may, I was wondering about the vaccination coverage, looking at DTP and measles. What are some of the causes of the suboptimal vaccination coverage in some countries in the region? Thank you.
Great. Thanks so much, Lauren. So 2 questions there. I'll give the first one to Dr. Muscat, and then I believe we have one of our divisional directors online to take the second one, but I'll introduce him afterwards. So Dr. Muscat, what are the main takeaways of this massive report?
Thank you. So what we are seeing is that whilst progress was happening, it has stagnated. And of course, we know that the COVID pandemic has had an impact. But we can't just sit back and be complacent and say the European region has always had the highest levels of universal health coverage. The European region has been doing well in reducing its premature mortality from non-communicable diseases. Unfortunately, we see this stagnation, and worse still, we see that in some countries, for example, mortality in children under 5 and even maternal mortality is also plateauing or increasing or reversing. So the key message to me, Banu, overall, is there is no time to be complacent and progress cannot be taken for granted.
Thank you so much, Dr. Muscat. Do we have Mr. Rob Butler online? He is the director of our Communicable Diseases, Environment and Health Division. Rob, have we got you online? We don't have Rob online. That's all right. I'll come back to you, Lauren, on your question about vaccines. But Hans, would you like to say something?
Then maybe on the question of the vaccines, there are a number of gaps into the health system. For example, accessibility, availability. So that are the pure health system challenges. But another big one, I think many of us are aware, of course, is the whole field of disinformation and misinformation. Last week, I was in the European Parliament for the first time at the Public Health Committee, and this was brought up by a number of parliamentarians as well, which has to do with the a movement we see in erosion in science. So that's very important, that we look to our entrusted messengers in the community, at the medical universities, at the professional associations, because what we see is that the people still have a very high trust in the healthcare workers, particularly the primary healthcare workers. So to strengthen the link with them, and then to strengthen the link with the education system. I always remember when I asked the former Minister of Health of Portugal what was the success of the high vaccination coverage, the minister was telling, because the children are being taught from very, very young age in the primary school. So the earlier we start, the better. And that goes also for how to deal with social media.
Great, thank you so much, Regional Director. I see we have another hand up, Sonia Wind, Bloomberg. Sonia, please unmute yourself and ask your question.
Hello. Thanks for taking my question. I have a question for Mr. Kluge. What or who do you blame for this stagnation that we're seeing in the progress in the health indicators? And is this a result of underinvestment of governments into the health systems? And what is your message to them, like at a time also where many countries are struggling with high deficits? Thank you.
Thank you. So a number of points here, and we're still trying to, let's say, see if there's a causal effect, because it's multifactorial, definitely. Speaking about immunization, infectious diseases, the aftermath of the COVID-19 is still very clear. I always say no, any health system in the region recovered from the COVID-19. Actually, we still will have to see the real impact of the mental health, for example. This is number one. Number two, let's remember that together with Deputy Prime Minister Frank van den Broek in Belgium, we launched under the Belgian EU presidency a first ever report on the terms of health, demonstrating that in our region, every single day, 7,500 people die due to 4 industries following a orchestrated playbook: tobacco, alcohol, fossil fuel, unhealthy diet. So there is a huge industrial movement. I also felt it at the European Parliament last week. And then we have to scale up the efforts all together, not top down, but the whole of society, on healthy lifestyle. And there I'm more optimist. I see younger people in many countries drinking less alcohol, eating not so much meat, moving. So I'm optimist too.
Good, and now on that optimistic note, thank you. I'd like to bring in one of our other divisional directors, Dr. Gouden Galea, and this sort of relates to what the regional director mentioned as well about some of these big industries. Dr. Galea, we recently issued a report on alcohol labeling. We've been quite vocal with regards to alcohol regulation in this region because we have this unenviable accolade of being the heaviest drinkers in the world. So could you maybe elaborate a little bit on why that might be the case? Why is Europe home to the heaviest drinkers, and is it simply down to culture?
There's a long history of alcohol alcohol consumption in the region, and we are the region where many of our member states are producing a very large amount of the world's alcohol. Many of the countries, the member states of Europe, have major alcohol industries, but they also have a lack of awareness. You raised in your point our recent report. Among the population, there is still a very high lack of awareness of the dangers of alcohol. And especially there's a big gap that we have recently highlighted in a large survey and a paper in the scientific literature, where we have identified a very low level of awareness of the strong link between alcohol and cancer. And it is not a surprise that some of the highest drinking countries are also now seeing increasing incidence of cancer in our region. So basically, there's good news that overall there is a slow decline in the region, but the levels of historical consumption were so high that we are still far above other regions in WHO. And within our countries, there is still a very low awareness of the dangers that alcohol poses for cardiovascular disease, for non-communicable diseases in general, and specifically for cancer. We have argued in our recent publication that member states of Europe should consider applying labels to alcohol products, at the very least to inform the population at the point of purchase of the carcinogenic potential of alcohol consumption. I hope that meets your question. Thank you, Banu.
Thank you very much, Dr. Galea. We have another question here from Portugal, from Christina. She says, the report shows that if nothing is done, digital dependence is only going to get worse and worse. So her question is, what does WHO recommend should be done about this? And are we talking about more restrictive laws?
Thank you, Banu, for that. So let me start by saying that the findings from the Health Behavior School Children Survey show that not all adolescents exhibit problematic social media use, and some, in fact, actually benefit from the use of the digital technologies because it provides them with a way to be in contact with peers and friends. Having said that, on the other hand, we see, for example, many young people being exposed to cyberbullying. There is no single one solution. It will require a public health approach and several solutions, starting again with education, literacy, empowerment, and then seeing, for example, in certain settings, whether the use of social media is appropriate or not, things such as age restrictions. As this becomes more pervasive, as we collate more evidence, we will be able to understand better what is the right package of measures that ought to be taken, not forgetting, for example, also educators and parents who they themselves need to be also informed about what advice they can give to children and adolescents.
Great, thank you. And of course, some countries are trialing a social media ban, and we will be watching that quite closely. So if there are no further questions online, I'd like to just close by giving the floor to the regional director once again, and perhaps posing a question to you, Dr. Kluge, about, well, you know, you mentioned this crisis that WHO finds itself in at this time, and of course there's US funding cuts across the organization, which is of course affecting us here in Europe as well. Would you like to say a few words about that before we close?
I think it's a good idea, Bano, because obviously that's the elephant in the room. So the US is a founding member of WHO since 1948, and we always counted very much not only on the financing but the expertise, the knowledge. And it's not only negative for the health of the people in the world, but also for the American people, because if we just think about the exchange of millions of genomic sequencing last year of more than 53,000 viruses, the whole world is now a small village. So this collaboration internationally is very important. Having said that, it's also a catharsis for WHO. I think WHO should reimagine itself. Very important. Listen to its member states and follow through. Be politically neutral, very important. If countries are fighting, it's public health. Who can bring them back around the table? If people are pushed into poverty and misery, it's public health, which can bring them back on board. And that's what we try to do also here in Europe. It's to modernize the governance, to AI, artificial intelligence, the red tape, and cut the bureaucracy. And I also would like to express appreciation to a number of countries which has been stepping forward. For example, yesterday we discussed with the Minister of Health of Spain, Monica Garcia, to see how Spain can support us in a field linked to health financing. Kazakhstan is really stepping forward to support WHO on primary healthcare. Ms. Sandra Galina from DG Santé last week, and all different directorates, be it External Action Service, ECHO, Executive Vice President, INTPA were stepping forward as well, but acknowledging that there are budget constraints. This is very clear. A lot of money goes to budget, so we have to be very realistically, but reimagine ourselves and WHO to go back to the future.
Thank you so much, Regional Director, for that. Now, on that note, let me close today's press briefing as once again, thank you to the Regional Director and to Dr. Natasha Azzopardi-Muscat, and of course, Dr. Galea, who joined us online. And thank you guys, members of the press, for joining this media briefing. For any follow-up, please email the press office, eupress@who.int. And as always, stay healthy, take care. Goodbye.